Hello and welcome to this video presentation. I'm Vicki Pite, one of the organisers of a conference we held on cervical cancer awareness during Cervical Cancer Week in January 2021. All the presentations were full of important information, support and advice about cervical cancer, so we've now made them available as several standalone videos. Here we have the first presentation at that conference by Dr Clare Stephens. Clare is a GP and also co-clinical director for the North Central London Cancer Alliance. Clare spoke about cervical screening itself, so let's hear what she had to say.
As I was introduced, I'm a GP, I'm a practicing GP, and I also work with our CCG, that covers the boroughs of Enfield, Camden, Islington, Haringey and Barnet. I'm a board member, and I'm very happy also to have recently joined the North Central Cancer Alliance as their co-clinical director. So the North Central Cancer Alliance brings together all the hospitals in our geographies across our 5 boroughs, in all their cancer departments, so that we work together to improve our outcomes, to give a better deal for patients, and to essentially make our pathways across the whole system work more smoothly. We're also involved in research and audit and all the R&D that goes behind delivering improved cancer studies. So if I'm going to share my screen now so that I'll just go into my presentation, and it's a general introduction about the challenge that faces us in relation to screening. If we talk about, say, cervical screening and why it's so important, we all hear that we should be going, we all know that it will help us identify cancer early. But the thing to really remember about cervical screening is it gives us the power and the opportunity to identify cancer or the likelihood of cancer very, very early on. And one of the things about that is true for all cancers is that if we identify them early, then our chances of being able to start treatment, finish treatment, and ensure that people come out of that in a way that they're cured or have an extremely long life course after is the opportunity to diagnose early. It also means that the treatments required if you do have cancer, when you have an early diagnosis, it means that those treatments are less likely to have difficult side effects for you. With cervical screening, the real magic about cervical screening is that we're able to identify before people develop true cancer, but in the progression up to that. So it allows us the opportunity to really help women. And if you look statistically at the benefits of doing cervical screening, if we run as a country the cervical screening program as efficiently as possible and encourage all women to attend when they're supposed to attend, then we have the greatest win in terms of lives saved, life years saved of all cancers. So that's really important. In terms of how we run cervical screening in the UK, we invite all women over 25, and you're invited to have regular smear tests. And as I've said before, it's really important to attend, because if you don't attend, then we can't work out if there's any problem with your cervix at all. The way that people are invited ranges through your ages, and you can see on the right-hand side of the screen here, talks about what happens when you're a woman between 25 and 49, and in that case, you're invited every 3 years to screening. When women are aged between 50 and 64, you're invited every 5 years. And if you're 65 or older and have never been for cervical screening, or you haven't had a test since the age of 50, then you can ask your GP for a test. GP practices are offering appointments either in their practices or in hubs where people will come together, and the hub will cover a whole geographical area. We invite women to screening in lots of different ways. So people will receive a letter, people will receive texts. When you go into your GP for other reasons, there are often posters up encouraging people to come. But interestingly, quite often people don't come. And there are lots of reasons why. And what we need to do as a country, and what we're focusing on doing this week, is trying to demystify what happens when you have a smear, encourage people to come, and reassure them also that it's safe to come in this period of COVID. We know from what people tell us up and down the land that people are frightened to come into hospitals or clinics. We worry that at this time, we know that people worry that they might pick up an infection, pick up COVID, and also people tell us that they don't want to bother GPs at the moment because they're busy doing other things. What's important for us all to remember is that if you don't come, we can't test you. And therefore, what we've decided as a country and as a cancer community across the country, supported by the Department of Health and NHS England, is that all cancer services are going to continue and have been continuing through this current wave of the pandemic. So we had a different situation at Easter of last year, when for a short time screening programs were paused. But this time, this winter, it's been clearly decided that none of the screening programs are pausing, that you can still access your appointments as you always did at your GP. And there really shouldn't be any problem in securing an appointment. And the practices are very well set up to ensure that people are completely safe when they come into the practice environment. Everybody wears PPE, and you shouldn't worry at all. I'm going to try and share a video with you, which in fact is made by one of our nurses, and the nurse that I work with, Tanya, talking about clinical screening.
Hello, my name is Tanya and I'm the practice nurse at the Cervical practice. This is a message for all the ladies in London, or anywhere else for that matter, because this message might be useful for you too, especially if you've been invited for cervical screening. With all the worries of coronavirus at the moment, we are all having a difficult time, but we would like to reassure you that if you need to come for your smear at the GP practice, not to be worried. Okay? We are doing absolutely everything possible for you to stay safe and as comfortable as possible during your visit of having your test done. We will also call you prior to your appointment to talk to you, to see how you're feeling on the day, and ask any other questions and answer any of your queries that you may have beforehand, and hopefully reassure you about the actual smear test. When you arrive, you will find that the nurse will be wearing a full PPE, and this is how it's going to look. So Kathy is going to show you. Hello, my name is Tanya and I'm the practice nurse at the Cervical practice. This is a message for all the ladies in London, or anywhere else for that matter, because this message might be useful for you too, especially if you've been invited for cervical screening. With all the worries of coronavirus at the moment, we are all having a difficult time, but we would like to reassure you that if you need to come for your smear at the GP practice, not to be worried. Okay? We are doing absolutely everything possible for you to stay safe and as comfortable as possible during your visit of having your test done. We will also call you prior to your appointment to talk to you, to see how you're feeling on the day, and ask any other questions and answer any of your queries that you may have beforehand, and hopefully reassure you about the actual smear test. When you arrive, you will find that the nurse will be wearing a full PPE, and this is how it's going to look. So Kathy is going to show you. Hi Kathy. Hello. So she will be wearing gloves, apron, goggles and a mask. And you will be asked to wear a mask too, and if you wish, we'll give you gloves as well. The test will last approximately 10 to 15 minutes, and the screening and it will be done by your nurse, and then you can go about your daily life and enjoy the rest of your day. Screening checks for the health of the cervical cells and also the evidence of human papillomavirus. This is important because if there are any changes, it is important that we spot them early, because the earlier we spot them, the easier we can treat them, and they never even get to develop to be cancer. Regular screening happens for the ladies between the age of 25 and 49, and that gets done every 3 years. For the ladies between the age of 50 and 64, that's once every 5 years. After the test is done, in about a couple of weeks' time, you will get a result in a letter explaining to you the results of the test and also if you do need to do anything else. If you are still unsure and if you would like to have a chat with any of the nurses, just call your GP practice and ask for an appointment. Any nurse will be happy to discuss it with you, reassure you and explain everything. Because what we need to remember, the screening actually really does save lives.
So I wanted just also to point people in the direction of the various other places that you can have cervical screening if that suits you better. So the first and easiest way is in any GP practice. Then some of the practices across our boroughs have out-of-hours hubs that also offer cervical screening. So locally you need to ask about that. And if there are issues in terms of wanting cervical screening sensitive to the needs of trans men or non-binary people with a cervix, then you can have a look at this detail here, and we can share this, I'm sure, Francis, later if people want to pick it up later. Make appointments at 56 Dean Street, or you can contact that number below or visit the site below. So I'll make sure that Francis has that number and those contact details for people who want to access a smear in that environment. So what are we doing as a nation to try to encourage people to bring their queries, concerns to general practice about anything related to cancer that reflects the issues that we have with what we would describe as common cancers in the UK. So those are the cancers that particularly are a problem for us in terms of numbers. We've started in partnership with NHS England to support the Help Us, Help You campaign. And this campaign has used up a set of different individuals to describe sorts of common symptoms that people should be alert to and should be coming to talk to their GP about. You may have seen some of this on some of our national advertising programs, on the television, on signage in around the place. Unfortunately, because of our restrictions on travel, none of us are seeing the signs on the tube or the buses on the ways that we used to. But I want just to, these little phrases are really important. I want you to remember them. That pain just won't go. It's just a little lump and it's just a bit of blood. I can't tell you how often I hear that in practice and how often people talk to me about it when they've had a later diagnosis of cancer. Of course, life's always easy when in hindsight, but for all of us, I think there's one single message. If you notice something about your body isn't right, isn't as it was before, then you need to come and speak to a GP. I know people often find it difficult to get through to your practice. There are different ways of doing that. You can email, you can do consultations online, you can pop in terms of wanting to ask to enter in and speak to reception. And you can, of course, you can write and you can phone. The important thing is to do something so that you make it clear to the practice that you've got a concern, and then practices will ensure that you'll see. If you find it difficult to speak to the doctor, then you can also speak to the nurse. And if and you'll find that way there's greater opportunity for people that you can talk to, and it should be much easier to get through and speak to people. If you want to visit this site that I've listed below here, smallc.org, which is a really useful site which describes different cancer signs, symptoms, and it also will recap what I've talked about, the screening, and cover the other screening programs. So, what I really want you to go away from here today is with the message, despite that the NHS is working hard, we're very busy, we're busier than we've ever been before, the cervical screening program is running. Please take part when you're invited. please always respond to the invitations. And if someone in your family has received an invitation, you know they've received an invitation, then nudge them to make sure that they've taken the next step and arranged to come and have a smear done. We've got lots of different places where you can have screening depending on your particular needs, and I've talked about that before. And overall and above all, if you have any worries, concerns, or you think something that you have an unusual thing that's developed in your body, as I said before, some pain that won't go away, a lump, bleeding, you're losing weight and you don't understand why, then please talk to us, because if you talk to us, we can sort it out. Thank you very much.
Well, I hope you found that both helpful and informative. We'll be following this with a number of other videos from the conference. If you want further information or have any questions, then please contact us. The email address will be at the end of the programme. Thank you for watching.